My name's Reggie Gilstrap. This is my hair, skin, and nails assessment. The first thing I would do is I would knock on the patient's door. I would then walk into the room. I would perform hand hygiene. I would then introduce myself. Hello, Mr. Black. My name is Reggie Gilstrap. I'll be your student nurse for the day. I'm here to conduct a hair, skin, and nails assessment. Is that okay? The patient will tell me yes. I will then say before this assessment begins, can I get 2 patient identifiers? He would tell me his name and date of birth. I would then ask if they were in pain using a scale of 1 to 10. And then from there, I would begin my assessment. So I would start off with the skin. Normally, patients wear gowns. So this patient will wear a gown so that way I could see their posterior skin and their buttocks. I would make sure that the patient's skin color is even throughout and appropriate for their race. I would then palpate their skin with the back of my hand, not the palm, and observe that it's warm, dry, smooth, it's intact, and it's smooth. I would ensure that there's no lesions, incisions, scars, or tattoos. I would see that there's no moles, no freckles, no tan. I would then check the patient for skin turgor. What I would do is just pinch the skin right above their collarbone, make sure it returns back to place, which is an indicator that the patient is well hydrated. If it doesn't, then the patient is dehydrated, or it can be a sign. I would then, from there, tell the patient that I'm moving on to their hair. I would look at the patient's hair and notice that it's a natural color. It's black. It's thick. It's full with no signs of balding. I would then inspect the patient's scalp and notice no signs of lesions, no abrasions, along with no manifestations or infestations. Um, from there, I would move on to their nails, and I would look at their nails on their hands. And I would notice that they're smooth, they're pink, they're natural. It's got a 160-degree angle from the base to the tip, which indicates that there is no clubbing, which is a sign of COPD. There's no ridges. I would check the cap refill, and how you do that is you press down on the nail bed and then let go, and it should return to pink within 1 to 2 seconds. And then I would repeat this process on the feet. I would do the same things to the feet to make sure that the feet are good to go also. At that time, I would say, all right, my assessment is done for hair, skin, and nails, sir. Is there anything you need? Can I do anything for you? Are you in any pain? If the answer is no, make sure the patient has their call light, and then tell them to call if they need me, and tell them thank you for their time. And that's my assessment.